All right, I think we're rolling. So, I wanted to share with you my routine for upper body health um, using deep self care practices. Um, so, cupping, blasting, or blading, self massage, and acupressure, and myofascial stretching, and other myofascial techniques. And so this will be beneficial for anything that is going on in the upper body, as well as just generally increasing health, because we'll be working with the heart and the circulatory system, opening the chest so we can take deeper breaths, uh, opening up the lymphatic system so that our sewer system can be functioning better and optimally, which really helps with immunity, and helping to drain any fluids that are built up in our ear canals, in our head, so that circulation, both with blood and lymph, can go up and down, and that our cerebrospinal fluid, the fluid that bathes our spinal cord and our nerves, can circulate properly as well. So it will really benefit the whole body. And how I often start is just by opening up the front area. And sometimes you can do that without oil, but I'm just going to go ahead and apply oil kind of in all the areas that I'm going to work today. And I generally use, for my body, I will use a jojoba oil, sometimes coconut, and for my neck and chest and face, I will use an argan blend with some type of other oil like rosehip seed or sea buckthorn, whatever I have. Right now I just have an argan oil, and I'm actually going to mix my body oil with a CBD oil. So I'm going to put this on first. And this is a blend that a colleague of mine makes. It's called Good Life Botanicals. And this is the Relief Red. So I think it's their deeper roll-on. It has a blend of essential oils that are rooted in Chinese medicine. So they were chosen for their specific practices in helping increase circulation and move lymph and relieve pain. And so this is the deeper one, so it kind of penetrates. It's not quite like a tire balm. It doesn't have that super warming effect, but you can feel it a little bit. It's more of a relaxation due to the CBDs and a little bit of blood moving and circulation support with the essential oils. So I'm just going to go ahead and put it all over. If you're interested in this oil, just message me. I'm not selling it in a store right now or anything. I'm just taking orders, and I'll place an order when I get enough. And it's lovely. It smells great. It's a really mild scent that I don't mind smelling a lot, and I have a really sensitive sense of smell. And she also makes a number of other products. She makes two different like salves or butters. One is a CBD with magnesium, and it has that really nice smell, the same really nice smell. It's got a good consistency, and I tend to use it on areas, the small spots that need a little extra support. And then there's a non-magnesium CBD salve as well. So those are some of the products that I recommend and that I'll use a lot on my body. So now that the CBD balm has soaked in a little bit, I'm just going to add a layer of jojoba oil down my arms, down my shoulders, and I'm using this time to connect with my body and to assess, kind of sense or feel what is going on with the different tissues. And I do this naturally as a massage therapist, but I have found that it's really important uh, for self-awareness to be able to assess what's going on with your own body. For example, you can look at your skin and see what's going on with it. I obviously have some redness in here, and that's been there for quite a while. And I know it's part of sun damage, but it also indicates some heat in my chest, probably with some anxiety or difficulty sleeping. Maybe some inflammation in my lungs, or just heat from my digestion rising up. And so you can note, obviously any moles or rashes or lesions, scabs, things like that. But one of the big ways of assessing is through our fingers, through feeling. And so we just start at the top layer as we're spreading the oil. And just enjoy that touch as much as you can. So what I'm using right now is kind of a medium touch. I'm not pushing too deep. It's more of what's called a therapeutic touch, which is not too fast, not too slow, kind of light to medium depth, or medium to firm depth, depending on where I'm trying to focus, whether it's assessing the skin and just underneath in the connective tissue, or going all the way into the muscle. And so what you're looking for as you're pressing is what's the condition of our skin? Is it dry? Is it rough? Is it smooth? Is it, what's the texture? What's the temperature? Is it hot or cold? And sometimes there may not be an answer. You just don't know. Sometimes it's neutral. But often, with at least one thing that we're assessing, it'll be a little off, not quite normal. And that's compared to where we are normally, as well as compared to kind of a baseline, right? So if you're touching your skin and wow, like it feels hot to you, then that's, something to pay attention to. It might not actually be super hot. It might just be hot compared to the other parts of your body. But again, we can compare to other parts of our body, because if heat is not circulating evenly through the body, that indicates that maybe there's a blockage somewhere. And so I definitely have a little more warmth in my chest than the other parts of my body. And so I've been focusing on clearing blockages through my chest, through my diaphragm and my ribs, so that the warmth in my heart can circulate and that it can flow with the blood and deeply warm and nourish all the parts of my body. So that's a big part of why we focus on the chest. Pain, of course, helping breathe, but really the heart, opening up and decompressing the heart can have a big impact on our entire body, on our mental outlook and our emotional state, because our heart houses our spirit. It houses our a very deep core energy that animates our whole body. So we need to give it space to do its work. And so we honor it with loving touch and therapeutic touch, spreading. You can see I've got some cracks here. A lot of that is from years of kind of being rounded forward, but also sleeping on my side. And so I do a lot of work of spreading this open and kind of going back and forth over that tissue to build up collagen. I'll work a lot on all the way down the breastbone, back and forth, up and down, working into the sides of the breast tissue. And we'll get into breasts in another video, probably just limited to the Vibrant, Abundant Goddess Temple group. So if you want to get more into breast health and how to deeply take care of your breasts with massage, stretching, things like that, come visit us in the temple, and we'll share that with you. So we can also use our cups, and if you haven't received our free cupping introduction video, just let me know and I can send that to you. It is a pretty detailed video about how to use cups, what cups to buy, kind of a general routine as far as how to apply them. And now I'm sharing in these further videos how to use cups and other myofascial tools in different areas of the body. So we can squeeze our cup, make a seal, and release it so that it sticks to our skin. And I have a nice light layer of oil on, so I can go ahead and slide it. If you don't have oil and you want to use your cups, just stick it on and let it sit, pop it off, and move it. You can see little red spots where it's pulled up the circulation. They're fading pretty fast because I've only left it on for a few seconds. If you leave it on for longer, there is a chance that you'll have a darker circle that might last a day to 2 days. If you have an area of injury and you leave it on longer, you could get darker circles that last up to a week. So just something to be aware of. And so I am just using my cupping tool to spread open the tissue. I'm not on my breast tissue, I'm on the muscle just above it, going out. So really thinking about spreading. And you can either go in, but sometimes that can hurt and really pull, especially if you have a lot of lymphatic buildup in the armpit area. And if you have a lot of breast tenderness and swelling even just premenstrually, it can indicate that there's some blockages. So you just want to be gentle. So if that hurts, you can just go out and lift up, out and pop off, and then just quickly squeeze it back on. When you're just starting out, it can take a while to learn to work with it quickly. So starting out, just go nice and slow. There's no rush. You can explore what it feels like to just leave it on for a few seconds. That's really tender right there. And it probably feels different than putting it on up here. So just see what it feels like. See what it feels like with different pressure gradients. So, when you squeeze it hard and really get a seal and let it go, it's going to create a stronger suction than if I just gently pop it on. And the popping actually is another technique that is valid in Chinese medicine. So pop, pop, pop. Just kind of along that area can be a nice way to gently introduce the techniques. And in between, just smooth it out, help to increase circulation and flush out anything that needs to drain. Spreading out. So I'm feeling a little deeper into my muscle tissue now. Kind of loosened it up with a little massage and the cupping, and I can press a little deeper. And I definitely have a lot of tension built up in there. But I have also been working on it a lot lately, so it's a lot better than it was. From years of doing massage, I had a ridiculous amount of tension built up in my chest and my shoulders. And so I've really been working hard to release that, and I'm really proud of it because it took a lot of effort, took a lot of consistency, but it's gone down quite a bit. And I had a lot of adhesions. I had a lot of stickiness where things just weren't moving right. And at this point, I can get in there and work relatively deeply without a lot of pain. And so what we're looking for is the ability to pull up our skin. That will assess the superficial connective tissue that covers our muscle. And if we can gently pull up our skin without a lot of pain, that's a good sign. If it's really hard and it comes up in big clumps, kind of like this area, that's just an indication that things are blocked in there a little bit. There's something sticking in there that needs to be worked out. And it's not a big deal. We can take care of it. It just shows that there's something that needs to be done. And so you can use your cup and let it sit a little longer in areas that feel more sticky, probably with a little less pressure because it'll be relatively tender. And we can also get in there and use one of my favorite tools, which is called the Fascia Blaster. This one is the Face Blaster. It's a little one. And it just has little claws. And there are a number of tools like this, but this is the one that I've found most effective. It's the one I use personally on a daily basis. I use on my clients, and especially with creating self-care plans. It's one of my favorite tools to recommend. Oops, let that go. So I'm just going to I'm kind of cover my breast so I don't go too much on the breast tissue. You don't want to use this tool on any fatty tissue that you don't want broken down. As well, the breasts have our mammary glands, which tend to be relatively sensitive, and we don't want to do any damage there. So I am just starting at the middle and going back and forth horizontally, slightly at a diagonal here. I can also go up and down. So especially in those sticky areas, we can focus a little bit of extra energy and attention. You can see it's getting nice and pink out here as well. So that means I'm increasing stimulation out in this area, allowing the heat that's trapped in my chest to circulate. So under the collarbone, here's my collarbone. I'm just going underneath it back and forth, and then really tiny up and down. We don't want to knock the bone if we can help it. You can go over the sternum, over the breastbone, as long as you're not going too hard. You can go down in between the breasts. There's just a little tiny bone that sticks out at the very bottom of our breastbone. We don't want to push hard with this tool on. So I would stay kind of above that area. You can also go into the side of the breast tissue, both in the middle and on the outside, just gently. Again, you're not working directly on the actual breast itself, just around it. You can go up and down in the middle, all the way up to the shoulder. We can also just start working on the shoulder right away. This tool, you can use it from the very beginning. I'll use it for spot treatments frequently, or do full body treatments with it. But often I'm integrating it into other forms of care. So combining it with self-massage, with cupping. If I'm really feeling sensitive, I'll do a hot bath or a shower first to start the area loosening up, or use a heat lamp or a heating pad, or just some sort of warmth to start the process. If an area is especially tender, a technique that I use a lot, like around the hips or around the armpits, is gentle tapping. And you can also do some lymphatic drainage to kind of prepare the area. But tapping is really nice just to start to wake up the nervous system and start things moving. And you can do it all the way down the arm. It's great to do all the way along the arm if you have elbow or wrist pain. Tapping the chest, under the back of the arm. And just, it's a good time also to make sure that there's enough oil. So, need a little more. I'm just going to do one arm for you so that you can get a sense of how to do it. I might also do some cups on my arm and let them sit there for a little bit while I'm waiting, or while I'm doing my chest work with the blaster. So, wake up the chest with the cups, move them to the arm, work on the chest with the blaster, move the cups to another area, and so on. So we're just cycling through each area with our different tools to work on different levels and different layers and in different ways. So, massage will get the nervous system stimulated. It will help to reset the muscles, to drain any waste products that have built up. We can smooth out the connective tissue. Then cups will get in there and help pull in a deeper circulation. The sliding will also help to stretch the connective tissue, and to help balance our nervous system, nourish our nervous system. And then the blaster gets in there and really breaks up anywhere that is stuck together, so that the nerves can have some decompression, circulation can be better. So I'm going to start working on my shoulder. I'm just going up and down on the front of my shoulder, and on the side, over the deltoid, get in on the top of the shoulder. And it's important when you're working up into the neck to be aware of where you're working. So here's my collarbone, and it kind of goes out here. Again, I don't want to hit any bone too hard. Sometimes you can go lightly over it. Then we also have the front of the throat. And so we don't want to go past this muscle here that pops out when you turn your head. The front of the muscle, that's our boundary. The front of the neck is a very delicate area. Obviously, we have our voice box, our thyroid is in there, a lot of blood vessels and nerves that run through there. And so if you do have a lot of tension or you want to do more work on clearing blockages, you can do vocalizations, breath work. You can find professionals that can do that deeper work or show you how to do it in person. It's not something I feel comfortable teaching over a video. So for now, this front of this muscle is going to be our boundary, and we can work anywhere along the back of the neck. Just be cautious of your spine. You can go up under your jaw. You just don't want to push too hard under here, but you can definitely work here, which is great for toning a potential waddle as we age. Oftentimes, tension all through the neck will pull that down, so we can use it to release tension. You can lightly go over the front of your neck with this tool, just don't push hard. You're just toning the skin. And to tone the skin, we go very light, back and forth and up and down, at a diagonal if we want, over the muscle that pops out here. Go both ways. So I love this little tool because it can get into all these nooks and crannies. So this little area, the crook of the neck here, you can kind of hook under the muscle and do little movements back and forth. And you can go have short back and forth movements up the back side of the neck. You can go up and down, you go a little further back. At some point it gets difficult to reach a certain level on the back, but there are other tools that you can use for that. We have a larger blaster that has extenders, or you can use cups in that area, or you can learn how to do it on other people and have your partner do it for you. So I'll do another video on that. I just need to convince someone to do it with me. So these have been sitting for a little bit. You can see some nice color. Yeah, not too bad. I've been doing a lot of arm work lately, so they tended to get a lot darker before I was doing that. And so I've had a lot of recovery. I can get in there and pinch and assess, gently pulling the skin. The front of my arm tends to have a lot built up because, again, of all those years pushing for massage. The back of my arm as well, just from bracing, have a lot of issues. I'm very lucky that I haven't had any carpal tunnel issues, although my right wrist has had a lot of structural issues with the bones. So I do a lot of work, and even though I do a lot of typing and crafting and writing, yoga with lots of pressure on my wrists, they've been doing really well. So I'm definitely a testimonial to these techniques and their power. And so I've got my cupping, I did my assessment. You can also assess down your forearm, just gently pinching the skin, rolling it around, making sure that it comes up in not too big of a chunk. And then if there's a big chunk, you know that that's an area that you can focus on. Around the elbow, you can definitely have big chunks, but you don't want to do too much work, too hard of work in a session, because there are so many nerves that run through there and you can inflame them, and we don't want to do that. So you're just doing more of a gentle pull and roll and then soothing. And then as you get down more into the forearm, you can definitely do some acupressure. So the muscle here at the top, if your thumb's pointing upwards, you can pinch that and then also press into it right in the middle. You can go back and forth or roll around in circles, and that will help to reset the muscle. And then you can go back and forth all along the length of the muscle, or strip all the way down the muscle in different lines to release deep tension and help the circulation. You can also do that on the muscle in the palmar side of the forearm. So I'm just stripping down and then rolling back and forth. And then we can use our blaster. Okay, nice and gentle around the elbow on both sides, front and back. This is probably the only area around the elbow that you can work pretty hard on. Everywhere else is likely to either be tender or you can just risk inflaming it and it's not worth the risk. So I'm just moving all around in all directions. The only direction you don't want to go with this tool is in a circle. So you can go up and down, you can go back and forth, you can go diagonally, both ways, whatever feels good. You can also, when there's a kind of crunchy spot or a spot that just feels off, you can get in there and dig a little harder. But again, you only want to do that for so long. You don't want to grind on one area with this tool for too long because it can cause inflammation. So we're just gently trying to release layers where the connective tissue is stuck to itself, stuck to the skin, stuck to the muscles. And it shouldn't take that long. These tools are better used for short periods of time regularly than really long periods of one chunk of time. So, working my whole arm, working my chest, both my arms might take 15 minutes. I can get it down to less if I'm not explaining what I'm doing. Or maybe I'm doing it in the shower with some shower gel, just really fast. It's great to do every day in all areas of the body, just really lightly. And then to spend longer amounts of time on specific areas as we need, which generally is the whole body, but we can break it up. Maybe spend more time on our areas of pain and tension and just do light work on the rest of the body once or twice a week. So that is my general routine for the chest and the arm. I'll go into the neck and head in the next video. All right, so let me know if you have any questions. Happy to help, happy to be supportive. I think that these tools are so important for as many people to know about as possible. It's my mission to help people get out of chronic pain with support, but also with deep self-care. It's really very empowering, and especially in situations like when we're quarantined at home and we can't really get the support we need, they become even more important. So I will be sharing more. Stay tuned.